When asking how to fill your cup, it starts with self-care, which is important for your overall health. Joining us now with more are Dr. Lana Gardner and Dr. Leah Teakle-Taylor from Docs Outside the Box and Kids Outside the Box. Doctors, it is so nice to see you both.
Good to see you.
So I love this about your practice because you treat each patient individually as their own person, and self-care is very important when it comes to how you talk to your patients.
Absolutely. Self-care begins with getting informed about the body. We believe education and investigation is the forefront of our practice, so we do traditional labs and expanded labs and custom labs.
So could you give me some examples of the labs that you call?
Absolutely. We'll use the organic acids test and the GI map test. Those are two custom labs. The organic acids test looks at the metabolites in the urine, and we can learn a lot about the metabolism, neurotransmitters, exposures, how we're breaking nourishment down. And the GI map test looks at a comprehensive stool analysis. So we're going to see pathogens, parasites, bacteria, virus. It's a complete look, and it gets us a lot more information than traditional testing.
Yeah, I wanted to talk about just the traditional labs that a typical doctor might order for you. That's really not enough.
No, it really isn't, but even with traditional labs, you can really find out a lot about the patient if you know where to look. For instance, we are really fanatical about sugar handling, sugar management. And so from traditional lab panels, we look at three things that anyone could look at to help tell us who's getting in trouble. We look at hemoglobin A1C, which tells us about blood sugar over 3 months, and we look at fasting blood sugar and fasting insulin, which tells us what the patient did overnight and what their old pancreas is up to. In this way, we're able to see not only pre-diabetes, but pre-diabetes and head it all off at the pass. It is not okay to be pre-diabetic even.
And when you look at these initial labs and you really go through them with a fine-tooth comb, are there other traditional labs or information that you find out that you can follow up with?
Oh, sure. You can follow those every 3 months and see how the patient's doing, but you can also look at what we call conventional labs. One of them is serum ferritin. That helps you see early on who is developing a fatty liver. We also look at homocysteine, which is a commonly run lab. That tells us a lot about the patient's natural glutathione levels. And glutathione is a very powerful natural antioxidant which tends to go down with age. So it's very important to look at. And even from regular lab panels, we can tell early on who's getting exposed to mold. And here in the state of Florida, it's a big problem.
And then that way you can treat people so they feel better.
Absolutely.
And you know, exactly, because with those, the type of lab work that you do as doctors is so individualized, it's so detailed that problems that are starting can stop or be held at bay.
Absolutely. Prevention is what it's about. Let's not wait till you manifest something physical in the body.
Because that kind of seems how, you know, a lot of offices, not yours, this is why we love having you on Bloom, but they react to a problem instead of really deep diving to find out what's going on with the patient to help prevent it.
Absolutely. And again, a lot of this is available in the regular labs you could get done anywhere at Quest or LabCorp.
All right, well, ladies, I always appreciate it when you come on Bloom and enlighten our viewers. Thank you so much.
Thank you.
Thank you, Gail.
And if you would like to reach Docs Outside the Box and Kids Outside the Box, they're located in St. Petersburg. The number to call is right there on your screen, 727-498-8898, or visit online at docsoutsidethebox.us. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Docs Outside the Box and Kids Outside the Box.